Well, there are a number of things that I've been doing and that we need to do going forward. First of all, back to my days in the state Senate, we would have these bills all the time to add a new mandate to the insurance programs. And I oppose additional mandates. Those gradually, slowly, but surely and inexorably drive up healthcare costs in Virginia. And that is not something that I support. That's something that I oppose. I also support the opportunity to offer different tiers of health insurance. We're now being sort of quarantined in our ability to do that by the federal health care bill, but to the maximum extent we can in Virginia, I want to continue making those options available, both to individual citizens and to our employers as part of the packages available there. I also think we should continue the efforts to expand transparency in pricing. Again, this is good for the healthcare consumer, often called a patient, and also for businesses as they shop for insurance and shop for medical providers, so that you can actually have market-like comparisons, prices and outcomes. What a concept. Unfortunately, in healthcare, we don't have much of a market because a lot of the government invasion of the entire market has dictated how it runs. And so we lose a lot of the market mechanisms that are normally there. You know, I was a small business owner. Dealing with health insurance for employees is something that I'm familiar with. Right now, I just heard from my father, who is also a small business owner. He has about 35 employees. And what the federal health care bill is doing to his company right now, he's over 60, comfortably over 60, and has one other older employee there. When they came up for renewal this year, they were told that the two of them either had to get off their own health plan or the cost for the company would rise approximately $50,000 because of the average age difference. Normally, making a statement like that would be a form of age discrimination. But under the regulations related to the federal health care bill, there's nothing wrong with that. And so literally, my father is getting off his own company's health plan and over onto Medicare to keep their cost increase down to a minimal level. And it also affects their employees because they split the cost of their health care with their employees. So the difference to his employees of him being on or off his own health care program is enormous, absolutely enormous. It's unconscionable that our federal government is forcing people off their own businesses' health insurance plans as a way to keep costs down. The price difference for my father's company was in the order of 15 to 20% for the entire company, just of removing himself and one other employee. And so now they're out on the government Medicare market, and the rest of us are helping pay for part of their care. I think that is just terrible. It's important for you all to remember that in my race for governor, my opponent, Terry McAuliffe, didn't think the federal health care bill went far enough. He wanted a full-blown single payer. I think that course has been already demonstrated to be disastrous for our health care. It's starting to limit people's ability to choose their health insurance provider. You remember, if you like your health insurance, you'll be able to keep it. Not so. Not so. Nor are we long going to be able to keep independent doctors making independent decisions. I believe that doctors ought to be able to advise their patients of whatever they think is best for their patients. But the direction that the federal health care bill is taking us is to invade that relationship. It is also going to be harder and harder to keep the doctor of your choice. I'm going to fight for all of these things. I'm going to fight so you can keep the doctor of your choice, hang on to your health insurance of your choice, and to keep your doctor's ability to provide you open and independent medical advice. As the federal government continues to push down on our ability to see freedom on the part of doctors as they interact with you in delivering your health care, that's something that we'll push back on in Virginia. That maintaining that kind of health care choice is very important to me, and I believe it's very important as well for competition and for keeping prices down. And in that vein, I'm someone who has supported buying health insurance across state lines, for instance, for individuals, which is not right now legal. I would legalize that in Virginia for the sake of cost competition. and look to get reciprocating agreements with other states so that we can expand the market for health insurance and increase competition and drive prices down.